And right now we'll transition to Michael Griswold.
All right. Well, good morning, everybody.
Morning.
So I'm here today to talk about an update and give the board an update on our performance management framework. We'll primarily talk about the corporate, the county's framework, but we'll mention the community work that we're doing a bit towards the end. So we'll jump in. So, I've talked to the board, and I'm sure you all have heard from Strategy and Innovation in the past about our commitment to performance management, and specifically the Managing for Results framework. I'll talk a little bit more about that as we move forward in this deck. But as part of the manager's recommitment to strategy and performance, we also wanted to do a little bit of a visual refresh. So we'll start today with something a little fun. And so as you can see on the left here, this was the Managing for Results logo and branding from the first time that we did the Balanced Scorecard here in Mecklenburg County, so around 2002 or so. Looks very much, a product of its time, we'll say. So one of the things that we wanted to do, again, as we recommit, is to update the branding so that we can modernize our approach and modernize kind of the look and feel. So this 2025 branding here, Managing for Results, evaluating today, strengthening tomorrow, I think reflects our commitment to the performance work, measuring what matters, bringing forward to you outcomes, and aligning the strategy for the county with the board's priorities and the outcomes that you are seeking. So just wanted to share that before we kind of dove into the meat of what we're going to talk about today. So, as I've given this presentation or a version of it to various different audiences, I always start with a little bit of story time. So we'll start with why. And I'll share an anecdote with you from back in the 60s or so. So as the story goes, President Kennedy was walking through the halls of NASA, came across a member of the custodial staff, and struck up a conversation with this individual. Was talking to the man about, what is it that you do? What is your role here at NASA? And the gentleman's response to the president was, my role is to help put a man on the moon. And so that, we could talk about whether or not that actually happened, but I think it is an illustrative example of what we want to do in terms of alignment here with the county. And really, it's about making strategy everyone's job. And so that doesn't necessarily mean that everyone will do strategy the way that I do it or that my shop does it in strategy and innovation. But what it does mean is that everybody should know how they connect to that mission. Everybody should know what we're trying to accomplish and how they can contribute to that. And so just in case you're more of a visual learner like I am, here's another way to say that. So, we often talk about why we exist, what we're doing here at the county, and everybody can sometimes have a slightly different understanding of that. And so when not everybody is aligned, if everybody has a little bit of a different understanding of what their role is, you can end up with an organization that looks like this, right? So everybody's well-meaning, everybody thinks that they're kind of rowing in the same direction, but in reality, you've got people kind of going off in multiple directions. But what we really want is to have an organization where we are aligned, everybody is clear about what they do, how their role contributes to the overall mission and vision of the organization. And we think that the Managing for Results framework and the Balanced Scorecard that we are recommitting to will help us get to this future state. So, starting with the alignment to county mission and vision, the chair has started all of our board meetings recently with a nod to the county's organizational mission vision and the board's community vision. And I wanted to highlight those here as well and, commit to you and share with you all of that. Our hope for the Balanced Scorecard is that we will translate these aspirational statements to measurable objectives that we can then report out to you all as we move forward. So I don't want to assume that everybody knows what the Balanced Scorecard is. So I'll start here very briefly. And it is a management system that helps us connect that strategy to action, like I was just mentioning. And so, it focuses on internal perspectives, external outcomes, and really leans into the continuous improvement cycle, which we'll talk a little bit later on about as that relates to the Managing for Results framework. But really, it blends both the operational and strategic views of the organization. And so on the right side of the screen here is a high-level kind of diagram of how this works. So these, in the lighter blue, So the customer stakeholders, internal processes, org effectiveness, and financial stewardship, those are what we would call the perspectives of the Balanced Scorecard. So that helps us to keep in mind the various levels and, different aspects of the organization. And really, mission feeds into that, but it is the interrelationship between those four perspectives that becomes the organization's strategy. And so as we go through this deck, we'll talk more about that, but just wanted to give you that little insight into the scorecard and speak specifically about how it blends that operational and strategic views. And we'll talk a little bit more about that here, because this is, I think, a different approach to how we've done strategic planning over the last decade or so. So these are the elements of the Balanced Scorecard. So, and we'll talk about each of these as we go through this, but at the top level are the objectives. That helps us understand the why we exist, what are we trying to accomplish, right? Tied to each of those objectives is a measure of success or multiple measures of success, right? So if we understand what we're doing, what we're trying to accomplish, then the next logical part of that conversation is how will we know that we've achieved that? How will we know that we're successful? And so we will tie those SMART goals or those measures or those desired results to each of the objectives that we define as part of the scorecard. And then from there, if we understand that there is an objective and there is a target for that measure of success, and we are not meeting that, or we think that we can push that higher, that is where the strategic initiatives come in. So that is the how we plan to accomplish our goals. What do we need to do, either initiative or project-wise, to help accomplish and achieve those desired results? And on the right-hand side here, you can see that as we go from objective to SMART goal to strategic initiatives, we are going more from the operational level of the organization down to the strategic, so that we can better understand how we're going to accomplish what we are trying to achieve. So we've gotten a lot of questions recently about why are we readopting the scorecard? And so my hope is that this slide will help make that a little clearer for you. But starting with our previous approach, we had fragmented efforts, right? So the strategic plans were, a little bit of silos. They were less connected, I'll say, to the overall priorities of the organization. So a lot of the guidance from my shop in the past has been, focus on the big rocks, those, handful of large ticket strategic items, which if you focus there entirely, then the operational day-to-day things of the county can kind of get pushed off to the side, right? So historically, we've been focusing on maybe the 5 or 10% of things that are more strategic, and the 90-95% of the operational day-to-day things were kind of off to the side. That can also result in some scope creep, again, so moving from that core operations to those new initiatives, which can have an impact, in some cases a dramatic impact on org capacity. Again, those weak linkages, so the strategy, budget, and performance cycles were not always as linked or aligned as they could or should be, which then resulted in our limited ability to tell you all and the public stories or help convey those outcomes with data. So this, moving forward with the Balanced Scorecard approach, we do hope that we're going to solve for all of those issues, right? So we'll have that unified framework to connect the core functions of every department to the strategic vision of the county, of the manager, and certainly of the board's priorities as well. We'll have a more simplified and more focused approach, right? So, focusing on, not necessarily measuring everything under the sun, but again, as it says here, move from volume to value so that we can shift the organization from maybe a performance measurement space to a performance management space so that we are measuring those outcomes that we collectively view as important. That will get us that stronger alignment with strategy, performance, and budget, and then helps to build that culture of learning, collaboration, and continuous improvement that we certainly want here at the county. So I mentioned these four perspectives a little bit earlier, but I want to give you a little bit more detail about what they are. And they are in a very intentional order. So we're going to start at the bottom here with organizational effectiveness. And that really is about the talent, the culture, infrastructure, and technology that we need as an organization to be able to achieve those outcomes that we want, not only internally, but for the community as well. So this is truly the foundation of the organization. From there, once we have that foundation in place, then we can ask ourselves, do we need to adjust or improve any internal processes so that we can work at the highest level possible, being as effective and as efficient as we can be? From there, we're able to move into a financial stewardship space so that we can make sure that we're maximizing the value for our residents. So we've certainly heard a lot of conversation this morning about needing to maximize the value of the taxes that we levy. Would agree with that. So the financial stewardship aspect or perspective of the scorecard is specifically about that. And then finally, those bottom three, I would call those our internal perspectives. And if we are working all of those to our maximal capacity, that would position us to be able to meet those customer and stakeholder outcomes that we define as part of the scorecard and in conversations with the community. So the perspectives are one aspect of the scorecard. The other aspect are the focus areas. And as I and my team were going through trying to figure out what we wanted to propose or recommend for these focus areas, we took a cue from the board and aligning it back to the board's community vision. So as you'll recall, the board's community vision is that the county will be a community of pride and choice for people to live, learn, work, and recreate. So we started there. That seemed like a great place to start. So we asked ourselves, for each of these aspects of your community vision, what are a couple words or a couple topics that would exemplify that for us? And so we broke those down, and so Live has kind of two aspects to it. But for me and my team, and certainly for those that we've talked to about the scorecard, if the county is going to be a place that we want to live, it's important that we be healthy and safe, right? Certainly with Learn, that has a nice alignment with education, work, with jobs, and then Recreate is broader than just Parks and Rec, but there are aspects of the environment, making sure that we are conserving that environment, but then also there are various recreation opportunities that we could align there. So again, continuing to develop that, health becomes healthy and thriving community, and this kind of blue row here, these are the actual focus areas that we've identified and defined as part of our proposed scorecard. Safety becomes safe and prepared community, education, learning, and educational opportunities, jobs and economic opportunities, and then environment, culture, and recreation. So recognizing that there are important cultural resources that we have here in the county that we wanted to call out specifically as part of that recreate aspect of your vision. And then from there, we kind of defined what each of these means, because our next step was to start aligning the work that the county does to this scorecard. So I won't read through these in detail for you, but just as an example for healthy and thriving community, we want to be healthy, safe, and have affordable living conditions for everyone in Mecklenburg County. And we thought that this is really a true encapsulation of that healthy and thriving community that we are trying to develop. And you can see the other examples here as well. So with that said, before I actually pull up the draft scorecard and get your feedback, wanted to level set for today, right? So we're going to talk through the strategic objectives that are aligned to this draft scorecard. And I'm specifically interested in getting feedback from you all about what we have included, what may be missing, and what may need revision. So after we go through that, we'll also give an example of kind of how the scorecard works. But out of scope for today is a full in-depth review of each of these objectives, any measures of success or initiatives that may align to those. That is work that we will do following today, and we plan to bring that back in January or shortly after your budget retreat in January. So this is just our next step to kind of gut check our draft scorecard with you all and collect any feedback that you may have. So with that said, just want to orient you to this slide really quickly. So on the left there, you've got the four perspectives that I mentioned earlier. And then along the top are the focus areas that we discussed previously. And so I mentioned earlier that the three perspectives that are more internal, those help build the foundation for achieving those outcomes. And collectively, if you think about those perspectives, you can see here that our goal would be to drive that internal service excellence through people, process, and stewardship. And collectively, that would position the organization to achieve the outcomes that we'd have in that top aspect of the scorecard and the goal of the community-facing objectives would be to improve that overall quality of life for Mecklenburg residents. Also, two additional things. So the objectives that we'll talk about here, some will have an asterisk, and those are the ones where we have proposed to align your board priorities. Some will have kind of gold dotted lines around them, and those are the ones that we expect will need some level of external partnership or collaboration. I'll also say that only some of the objectives that are going to be in the community space, at least in this draft, have that gold outline, but as we continue to develop them, would certainly expect that most, if not all, of the community-facing ones would end up with some sort of external collaboration required. So with that said, we'll just jump on in here. So again, starting at the organizational effectiveness level, so we've got 4 proposed objectives here, and these really are, like I mentioned before, about building that internal infrastructure, the people, the technology to position the organization. So having that dynamic workforce that reflects our community and fosters belonging, that would certainly be a lot of the work that our Office of Equity and Inclusion is working on, and certainly the board's priority around reducing racial disparities would play a big part there. Improving that technology and utilization capacity, so making sure that we as an organization are leveraging technology to the fullest extent to be able to accomplish these goals. Work related to that would certainly align to that objective. Strengthening the accounting culture and investing in that county workforce. This explicitly aligns to the manager's organizational reset, making sure that we are building that county culture and being a place where individuals want to work and that we have that strong foundation. So, the culture initiatives, but then also things like retention or vacancy rate or turnover, knowledge, skills, and abilities of county employees, to all the things that might help us understand whether our employees are positioned to perform at a high level and to help us to achieve some of our overriding outcomes there. And then finally, in the organizational effectiveness space, enhancing the data that is available for decision making. So certainly there would be an IT component there, but I think that there is a lot of work that all departments can do in this space, not only making data available for you all, for the executive team, but also for those in the department so that we can work to achieve those kind of data-informed outcomes and objectives that we define for the organization. Certainly the performance work that my shop does, the kind of alignment between budget and performance and strategy that happens between my shop and OMB would be aligned here as well. And so collectively with all of these objectives, we think that would form the foundation for us as an organization so that we could go to our internal processes and start asking ourselves, is there anything that we can do differently or better or more efficiently and effectively? So strengthening those partnerships and community collaboration, we've talked a lot about that here already today. I certainly expect that we'll talk more about that here over the next 2 days. But that is, I think, an important part that will directly contribute to the dotted line items that we'll talk a little bit more about in a bit. We also want to make sure that we're promoting that high-performing government through efficiency, accountability, and transparency. So are there things that we can do better, differently, or just reconsider how we've done things so that we can have a greater impact on the community and internally. Then we've got increasing that community awareness and engagement, again, that proactive communication and outreach, so making sure that residents of the community understand who we are, what we do, what our programs are, and what programs they may be able to interface with, I think would certainly be important there. And then a nod to risk and policy compliance. So we have an internal enterprise risk management committee. We often talk about risks at the department level, risks at the enterprise level, and certainly recognize that for us to achieve the outcomes that we want to achieve for the community, we need to keep an eye on risk and risk mitigation. So after that, moving into the financial stewardship space. So obviously we want to make sure that as stewards of taxpayer funds, that we are using those responsibly, transparently, and sustainably, again, to maximize that value for residents. And in line with a lot of the conversation that we had this morning, making sure that we maintain that affordable and competitive tax rate. So all of these things, I often refer to this as things kind of below that line. Those are the internal items that will help us drive that internal service excellence and position us to achieve the outcomes that are more community-facing. So in the healthy and thriving community, improving access to care, that's certainly a board priority with your health, equity, and wellness. Making sure that residents have access to safe and affordable housing, very much in line with the chair's presentation this morning. Reducing hunger and improving nutrition across our community. And then increasing the stability for individuals and families. And this increased stability for individuals and families, that is also where we would propose to align the services for seniors. That is, again, another of your board priorities, as well as other things like youth and family services, services for adults, other health and human services work. So collectively, we would expect that once we get through the process of defining the outcomes and the measures of success for each of these items under healthy and thriving community, that those would be the things that we could lean into to achieve those outcomes for the community. Moving over to learning and educational opportunities. So we've talked a lot about K-readiness over the last handful of years. So improving K-readiness for MEC pre-K students, which again certainly would be in alignment to the board's education priority. Promoting that literacy and digital access. So that's partnerships with not only county programs and partners externally, but the library, the school system, and other partners and community leaders who can help us to promote that literacy and digital access. And then finally here, supporting student success through partnerships with local public schools and higher education. Again, leaning into the education aspect, this would be the partnerships and work that we can do with CMS, with CPCC, and others. Collectively, those would help us to make sure that we are leaning into the education priority from the board. Moving into jobs and economic opportunities. So this first one, promote economic mobility by connecting residents to jobs, training, and career growth. Again, this is the board's workforce development priority. We've heard about that this morning, and we've got another presentation coming up as part of this retreat. But this would be where we would propose to align the county's workforce development initiatives. So that would be certainly internal things, CPCC as well, Charlotte Works, all of that collectively, so that we can have a shared vision and direction for workforce development for the community. And then making Mecklenburg County a premier place to start, grow, and sustain a business. Again, leaning into the board's economic development priority with this one. And then finally, reducing financial barriers by connecting families to economic support services. That would be things like child support service over in our Department of Community Resources, economic services divisions, so things like SNAP or Medicaid services that would help them economically. Moving into environment, culture, and recreation. So this first one, leaning into the board's environmental stewardship priority, enhancing that stewardship through conservation, monitoring, and sustainable practices. Next, we have expanding access to parks, open space, and recreation. So this is where our proposed scorecard aligns the land acquisition, the park facility enhancements or improvements that we've talked about with the board. And certainly those first two under environment, I think there's strong alignment with our environmental leadership action plan as well. And then finally, leaning into that culture aspect of the Balanced Scorecard, or in this respect, the focus area. So protecting and promoting the historic arts and cultural resources within Mecklenburg County, recognizing that there's more than just environment, there's more than just parks. There are important cultural, resources within the community. So the board certainly heard about Excelsior at a recent board meeting, things like that to identify and lean into preserving some of that history, the arts, and the various cultural resources that we have. And then finally, this is the second aspect of the LIVE alignment to your community vision that I spoke about earlier, but being a safe and prepared community, right? So supporting those policies and practices that enhance public safety and reduce recidivism. Certainly that would be a lot of the work that we do in our Criminal Justice Services Department, the work and partnerships that we have with our Sheriff's Department and the local justice system would certainly align there. Ensuring that the safety of buildings and public infrastructure, there's a lot of code enforcement work that we do, a lot of work that we do on things like sidewalks or streetlights as part of our community development block grants. That's where we would propose to align that sort of work that the county does and should continue to do. Then provide programs that protect residents and promote recovery, resilience, and safety. So this is where we would propose to align some of the work that we do over in community support services with our veteran support, with our domestic violence support for the community, and then substance use and abuse work that we do in the community as well. So again, leaning into that safety aspect of some of the work that we do in health and human services. And then finally, promoting a timely and reliable emergency response and forensic investigation. So we've talked a lot about MEDIC in the past. This is where we would propose to partner with MEDIC to report out some outcomes there, as well as the work that we do policing in unincorporated areas, volunteer fire departments, as well as within criminal justice services, we have a forensic investigations unit that helps us with some of those investigations on the court side. So this is our proposal in terms of a placemat that outlines all the things that the county does and should do. And in terms of how you can read it, if you read this from the bottom up, it will tell you why we are doing some of these things, right? So why are we trying to strengthen county culture and invest in the county workforce? So that we build that foundation to work on those internal processes, so that we continue to build that foundation to be good financial stewards of the taxpayer funds. And we do all of those things so that we can work to improve and deliver the outcomes that we've heard from our community that they need. Conversely, if you read it down, it'll tell you how we're going to do some of those things. So how are we going to deliver the healthy and thriving community? Well, we need to build that foundation internally and within the organization to be able to deliver those results. And critically, this not only works in 2D on this page, but some of the work that we'll be doing later this year is building similar scorecards with departments. And that reading up for why, down for how, will also work in 3D as you read up from why does Department A do this. It's so that it'll support the aligned outcome here on this enterprise scorecard. Or if you read down, how are we going to accomplish some of these things on the enterprise scorecard? It's through the work that will happen within departments. That will continue to be refined as we move forward, and we'll bring that forward to you all at a future date. So I mentioned that the scorecard is really a placemat of the work that we do. And as I was going through each of them, I gave you all a little bit of a preview of the types of things that we might align to those. So I'll kind of skip through these in a little bit quicker detail, but this is just another example of continuing to drill down from the overall objective to the type of work and programs that could be aligned to those. And where appropriate, if there is a board priority alignment, we've indicated that for you. This is just another example of those strategic objective alignments, again, for a more internal, perspective or focus area, so this with the organizational effectiveness. And then you can also drill down the next layer. So you recall that I mentioned that we will identify measures of success for each of these program alignments, and that's what this slide does. So I will say this is a fictitious, made-up example, but it is an illustrative example of kind of how this work will happen. So the scorecard alignment would be internal process. In this particular example, there's no board alignment, but if we were trying to promote that high-performing government, what could we do? So in this instance, we're looking at a potential call center that may exist. And so the goal here would be to achieve a 90% or greater customer satisfaction with that call center by FY 2028. So leaning into the SMART goals that we've talked about here with the board. So again, the target in this example would be that 90%. We will provide you all with recent results. In this fictitious example, those are just kind of blank. But then, recall that I mentioned that going from the objective to the aligned measure of success, that will tell you whether we are moving in the right direction. But if we're not, then we have to identify strategic initiatives to try to move that needle in the right direction. So here are some examples of some strategic initiatives that could be relevant in this example if we were not meeting our 90% goal, right? So perhaps there is some training that's needed for call center staff to increase that first call resolution rate, so to prevent people from having to call back multiple times. That could certainly lean in and improve the overall customer satisfaction. Conversely, there could be, a driver of poor satisfaction might be that calls keep getting dropped. So maybe there are technology investments that you could make to drive that customer satisfaction. But at a high level, it's about identifying what we're trying to achieve, understanding current performance and how that relates to our goal, and then identifying projects or initiatives that we can work on that are related in some way to try to drive that performance moving forward. So again, giving you all another example, just in case you're more visual like I am. So every day, we're trying to achieve these things, and these are the same perspectives that we've talked about previously. So as an example, and this is a real example from our Louisa 26 through 28 strategic plan that we had worked on before we started moving to the Balanced Scorecard, but they noticed that there was an increase in flooding in recent years, and they needed to figure out a way to address that. And so you recall that I mentioned as part of this model, once you identify that you are not meeting goal, then you have to identify some initiatives that could help to move that needle in the right direction. So in this example, they identified that we could try to reduce the flood risk by 193,000 points over 15 years as part of the ELAP. So recognizing that a lot of this work takes time, it's going to take investment and consistent work, but if we start mitigating flood risk, then we can drive down that flooding that we might, or that increased flooding that we have seen. And then from there, it's really about circling back to the outcome that you were trying to achieve. So you noticed that you weren't achieving it, you identified an initiative or multiple initiatives that you think can help move that needle, but that's not enough. You have to know whether or not it actually did move the needle, because there could certainly be a number of things that we could do that may have theoretical or logical connections to this work, but just because you work to reduce that flood risk doesn't necessarily mean that flood will be reduced. So it's important to lean into that continuous improvement cycle to know what you're trying to achieve, whether the data says that you're moving in that direction or not, and if you're not, how can we revisit that? So that, in essence, is the Managing for Results framework. Managing for Results is this cycle over off to the side. So define those goals and objectives, plan your activity or your resource allocation, monitor the progress and performance, evaluate the results, which is critically important. I'll talk more about that in a bit, and then figure out how you're going to learn from that and adapt, and then you start the cycle over. So adding in or leaning more into this Managing for Results framework, in addition to the Balanced Scorecard, gives us the two pieces that we need. So the Balanced Scorecard helps to define that strategic direction. Managing for Results is the management system for how we will implement and drive those results. Again, Managing for Results connects strategy to action. It aligns the budget and strategy, again, leans into that continuous improvement. So it's not about collecting data, it's about using the data, which I talk a lot about this with staff and with departments, about moving from a performance measurement perspective where we're collecting 1,700 measures across the enterprise, and that takes up quite a bit of our time, so we don't necessarily have capacity to use the data, right? So streamlining, moving from volume to value, measuring what matters so that we can move forward and use that to drive outcomes for the community. And then doing all that will help strengthen transparency and public trust. So I talked about the Managing for Results framework, and if we were starting from zero, that would be a big lift to implement that, to institutionalize something like that within an organization of our size. The good news, though, is that we already do this, right? So this was something that was stood up as part of the Balanced Scorecard 1.0, if you will, back when Dr. Johnson was in my role in strategy and performance. Dr. Johnson stood up the Managing for Results framework and the Balanced Scorecard 1.0, and this is our current performance cycle. So we start with strategy. What are we trying to do? Again, begin with the end in mind. We partner with budget to have that resource allocation. My team works with departments to understand performance. Are we meeting our goal? And then I mentioned this evaluation piece earlier. So it's not just enough to know whether we are or are not meeting goal. We need to know why or why not. Because understanding the why or why not, that will help you understand what appropriate strategies may be required to kind of course correct or move your performance in the direction that you want to go. And then once we have that evaluation, once we know what did or did not work, we can then have the strategy conversation about what we need to do to address that, to continue to move the needle, and then we just start our cycle over again. So in terms of next steps, and this is, I think, my last slide or one more, we've shared the draft scorecard with you all, certainly interested in your feedback on structure and content. We'll then pretty much immediately start working to incorporate feedback that you all have, building out those goals and the strategic initiatives for each objective. I'm going to talk about on the next slide the quality of life collaborative convening that we're going to be doing. It's a community meeting that we will hold at the end of November. And there certainly could be community input and feedback that could be relevant for the scorecard. So we'll keep an eye out for that. And then again, our goal, as I mentioned previously, is to finalize all of this to bring it back to you all, if not at your January retreat, shortly thereafter. And then once approved, we will then, that's where kind of the rubber meets the road, right, of building out the focus area collaboration teams. These are the kind of the teams that will be in charge of measuring and reporting out results, helping us to manage each of the focus areas. Historically, and we certainly expect to do this again, they were chaired by a member of the executive team and staffed by somebody from my team, and certainly made up by or comprised of the directors and subject matter experts that would be relevant to the work happening under each focus area. We would work to update any reporting processes for the executive team and the board, and then we get into the work that I mentioned earlier about working with departments to develop those department-level scorecards. And then we have an upcoming conversation with our Human Resources Department to work to make sure that everybody's work plan is aligned in some way, shape, or form to the final scorecard. So that gets back to what I started off our conversation today about, which is making sure that the organization is aligned. Everybody knows how they contribute to the overall direction of the organization, which is how we kind of get everybody rowing in that same direction. So last thing that I'll share today, I mentioned the quality of life collaborative. The manager mentioned this previously in some community meetings that he's been hosting and convening. So we are going to bring together public, private, nonprofit, and community leaders on November 20 and 21. This is a 2-day retreat. I'm leading this along with Rebecca Herbert, who was here earlier, so she'll help us facilitate this. And our goal is to position Charlotte-Mecklenburg as that premier place to live and to strengthen that cross-sector collaboration and collective impact. So breaking down those silos, recognizing that a lot of the problems and issues that we see as a community are not things that the county can unilaterally address, just in the same way that they're not things that the city or CMS or any of our partners in the community can unilaterally address. But to move the needle on some of these larger community issues will take collaboration and intentional collaboration for how to collectively move that work forward. So more to come here, but this is something that we're very excited about that will be happening here over the next few weeks. So with that said, happy to take any questions that you all may have.
All right, thank you, Michael, for that. Can you go to the slide where it was in the beginning where
Wrong way.
it was the specific feedback that you wanted, the questions that you wanted the board to address? With that being said, let me see from colleagues who has questions or feedback. I'll start with Commissioner Powell.
Thank you.
Got you.
Thank you for your very thorough presentation. This reminds me, well, first, I have so much input that we need to have a meeting because you can't have a healthy and thriving community without environmental stewardship. So there's a lot of overlap. And so what it reminds me of is in 2010, how Livable Mech was born. So it was born out of a concern for the rapid growth and environmental impact. And that's how it was born. And then it became so big because of all the community input. And so there's so much overlap in here that I feel like we need to have a meeting with Livable Mech and with environmental stewardship to make sure that it's woven in the way it needs to be woven in. And I'm really glad you gave an example from Louisa, because a lot of times when we're in these very formal meetings, we only get information that's filtered. And that was a big worry for a long time about how are we going to prevent these floods with all of the rapid growth and the increased impervious. And so it's a real life worry that sometimes doesn't come to this level, that should come to this level. So I love this work. It's very detailed. And I think if we started out right with input from my perspective, from Livable Mech and from environmental stewardship, it'll be stronger.
No, I would agree with that. And so that next step, I mentioned that once we receive this feedback, we'll start working with departments to build out, departments and functions, to build out this work. So your recommendation of partnering with Livable MEC, environmental stewardship, and the like is perfectly in line with our next steps.
Thank you.
Thank you. Commissioner Griffin.
Thank you, Mr. Chairman. Couple of points real quickly. Suzette came around one day asking me what particular area I was excited about, whether it was housing, or education, et cetera. And I kept saying, well, I'm really concerned about how the work is done. And she did. You remember that, Suzette? This sort of brings an opportunity for us to put our arms around not only the outcomes, but how the work is done as it relates to the resources, because we have to respond to the manager's budget request. And certainly, we have to give them the resources if we expect certain outcomes. And this management approach called a Balanced Scorecard is something that we embrace. George Dunlap and Bill Malik are familiar with this from the Charlotte-Mecklenburg schools that we put together in the 90s. And it really helped us to go to another level. So the two questions I have, and I do the one on the example, you have improve access to primary care. Mm-hmm. And Dr. Washington is aware, I always ask the question, is it a verb or a noun? What are we talking about? Because there are different ways to define access to care. Is it geographic access? Meaning the clinic is next to you, the medical bus comes to you, you got transportation. So that's geographic access. Financial access to care could be I got more people on Medicaid than I had last year. Or functional access to care could mean more people now go see a primary care physician. So it goes back to your point on one of your slides about what are we trying to accomplish? So if you're able to describe, for me and others, when you say improve access to care, what are you trying to accomplish? Then you can come down to your various steps to be able to get to being able to say what's the outcome rather than the output. Sure. So I would just ask you, Michael, have y'all had an opportunity to describe whether or not access to care is functional access, geographic access, financial access? What do you mean by improving access to care? And I think in all of your objectives, if there's some clarity about those, then how the organization responds to those, whether it's workforce development or whatever it is, gives a better response. So I'd like for you to respond to that. The second piece, Mr. Manager, this is good stuff, good work. The challenge is, what's your, have you decided your approach for implementing this? Because to change the culture, you're going to have to introduce this to 6,000 people because, as Michael said, the custodian at NASA, well, we got custodians here. Sorry about that. But we got people at the bottom level that got to buy into this. Sorry, Mr. Chairman.
I'll respond to your second question and have Dr. Campbell respond to your first question, she and Dr. Washington, regarding access. Regarding how we're going to incorporate this, you're right. This requires a change management plan, including a communication plan, and we've discussed this as a cabinet when this was presented to them last week. It's very critical to ensure that we roll this out to the entire organization. It's that old saying, what gets measured get done. One of the ways that we talked about ensuring that this is rolled out properly is, and Mike mentioned this, is to factor as part of their work plans so that they can have an understanding of how they influence the areas that they are tied to as well. Every employee in the organization currently has a work plan, and the work plan will be incorporated. It will have a link to our new Balanced Scorecard as well. But Suzette and others will assist us with developing this change management plan. So that is on the radar. And Dr. Campbell can respond to your first question.
Thank you. So if you're speaking specifically to primary care, then I would defer to Dr. Washington to articulate what his vision is around that. I have a tendency to up-level the thinking around this domain and would characterize it as increased access to services beyond primary health care, because I think there's an issue with access across many of the county's services in many of the county's departments and divisions. And so we have not yet met to map out what the objectives will be, but I think your point is well taken that there are different ways to define access, and I think that the answer to the question will vary depending upon the service, the division, and the department about which we're speaking. And I think that the scorecard should be all-inclusive beyond primary health care and elevated up to services generally.
Commissioner Rodriguez-McDowell.
Yeah, I just had a question around, on the last page talks about the Quality of Life Collaborative. Is that something that you want commissioners to come to listen to whatever's the?
So this community collaborative meeting is something that I've discussed with you all, as well as our community partners. You may recall that I went on this community listening tour when I was first appointed to the role. And during each one of those discussions, I concluded with the question asking would they be willing to collaborate with the county to address some of these problems that we are facing. And all of them responded with a resounding yes. So this is me putting their commitments to action. Regarding attendance by our board, the only elected official that will be in attendance is our district attorney to ensure that we have representation from that public safety angle. Outside of that is cross-sector, as Mike mentioned, corporate sector, our philanthropic community, our nonprofits as well. And the goal, the objective is to get in alignment, just as we are with our scorecard. But recognizing the Balanced Scorecard is the framework that we're going to manage to a Mecklenburg County. But our partners may choose to implement something else. But what we can all agree to is having a high quality of life in our community. So as our chair mentioned this morning, as he was discussing affordable housing, it's important that all of our partners that have some involvement in affordable housing, that we have some commonality in terms of how we're going to gauge our process, our progress in that space. So that's what the purpose of that meeting is, to identify all the indicators that we agree to regarding having a good, healthy, high quality of life, economic development, workforce development, affordable housing, education as well. And then what are the metrics associated that we can all manage to in our different entities to ensure that we're in alignment? And this meeting is not only going to be hosted by myself, but my partners will include Dr. Hill, CMS, as well as City Manager Marcus Jones. Because when you think about the quality of life and the influence that our three organizations have, I thought it was really important to invite them to partner with me in this meeting in November.
Okay, thank you.
Commissioner Townsend Ingram.
Thank you so much. This takes me back to my teaching days, so I love it. Processes and procedures and things of that nature. And I think I'm going to try to carve this down to just 3 questions because I too have, there's so much here to unpack. How do we determine what data is needed? Like you made specifically that, you wanted to move, and that was very impactful. You wanted to move from just collecting data to actually using the data that was collected. So my first question is, how do we determine what data is needed in that process? Because there's qualitative data and there's quantitative data, and you can make either sound the way you want it to, and that has to be defined in order to meet the objectives that you want to meet. Second question, do we produce all of the data ourselves, or do we partner? Do we source it out to like UNCC, for stuff like the Quality of Life Explorer? Is there overlap with the Explorer where we're producing data with that? And then what's the scope of the scorecard? Is it just for us internally? And I ask that question because I'm thinking about our advisory boards and how they operate. They're supposed to be advising us on certain things, but if we don't know how they're arriving at their decisions, and then we can't really trust, I don't want to say trust. how do we know that what they're advising aligns with the outcomes that we're trying to achieve? Because otherwise, there's no use of them.
Absolutely. No, I think those are very relevant and salient questions. So, to your first one, how do we determine what data? So my team is already working with each department to better understand, the purpose of each of their programs and services, and to recommend revisions to their portfolio of performance measures. So, I mentioned earlier that there's 1,700 or so across the entire county. And so recognize that some services and some programs have pretty quality measures, and they're, can mostly be okay as they are. Some will have maybe a lot of measures that perhaps are not as high quality, high value, or as impactful as they should be. And in those cases, we're, again, starting with why, right? So why does this exist? What is the most important or the best data point to help us understand whether we are moving the needle or moving in the direction of the stated purpose of that program or service? And then, to your point about whether or not we collect all that data, it certainly could be that in some instances, I'll call it the quote unquote correct data point, may be something that we already track, and that's great. It may be something that we don't track already, but we can work to identify how we do that because we already have some of the data elements internally. But to your point about the Urban Institute and the Quality of Life Explorer, they're actually one of the groups that we've invited to the Quality of Life Collaborative, because certainly I do think that there are opportunities, if there are overarching kind of community level indicators that we want to track, potentially community or regional level indicators even. I think the Quality of Life Explorer and the Urban Institute could be a partner to help us measure some of those things. So we're certainly continuing to investigate that option as well. And to your point about the scope of the scorecard, so the manager mentioned earlier that the scorecard is how we are going to operationalize some of these things. So it is primarily an internal tool. I mentioned earlier that there could be some things that come out of this community meeting that are relevant or influence our scorecard. And in that instance, we could incorporate some of that. But I would answer your question as it's primarily an internal tool. But the purpose of the manager's collaborative convening is to identify how we will collectively as a community measure and address those things. But certainly, Mike.
Yeah, that's correct. To hit you right on Mike's response, whether it's referred to as a scorecard or some other type of tool, the goal is to get in alignment next month and to have some commonality in terms of how we report and manage in the organization with our partners, our nonprofits, for example, to ensure that when we are defining what success looks like, that we're defining it collectively. Currently, although our partners are assisting in this space, if you think about the visual that Mike pointed out with the arrows pointing different ways, that's currently how we're managing, and it's important that we're all pointing in the same direction.
Thank you.
Thank you.
Commissioner Altman.
I'm just very excited by this. When companies
manage for whatever it is they're trying to do, there's a very close nexus on successful ones for what they are trying to achieve and whether they've achieved it on a quarterly basis. And obviously, we're different than that. We should be different than that. But we are stewards of the public's money. And what we know is that we don't have enough money to remotely address all the needs. And therefore, it is so essential that we identify what programs are working and what ones that may have been well-intentioned and a good idea that are not delivering, so that we can repurpose that for things that will do the most good for our residents. So I'm really excited about the higher rigor, the tighter nexus. I love the manager's vision of defining success with our partners and moving towards it collectively. And, I was, just as a final thought, I was talking to somebody weekend who defines themselves as a fiscal conservative, and we were talking about our unsheltered community and how that's going here. And what they said to me was, I would be happy to pay more taxes to address this if it was actually going to help. So I just feel like for us to identify our community problems and to do it actually effectively, we can go a long way to bringing our community together for the work that we need to do to address our local issues. We won't agree on all the goals and all the methods, but we could do a lot. And for the community to hear in this public meeting and in a transparent way, the leadership that our manager is helping us to get in that direction relative to the guidance that he's received by this board is just awesome. So thank you.
All right, I think everyone that wanted to speak has spoken. I will say this, Michael, you have done, you and the team have done a tremendous job. I really appreciate this. I think the one thing that I always want to avoid is trying to do too much, right? Just overkill, where we won't be able to measure anything, because you can think of 1,000 different elements to add. One thing that I would say is I think it's a great starting point with the additional feedback that you'll get from board members. So thank you for that. With that being said, I'm sorry, Commissioner, did you have something?
No, I just going to say it was excellent. Doctoral presentation.
Agreed.